Good evening. My name is Dr. Jonathan Edwards. I'm here today to talk to you about ketamine, anesthetic to healer. What does it mean exactly? What does it mean to be, it's an anesthetic and a healing medication? Can it be both? Is it safe? Is ketamine safe for you or your loved one? Did you know ketamine can stop suicide in its tracks? Every suicide ends one life, and it rolls the grenade into the lives of many others. I experienced this firsthand when I was 7 years old. My grandfather took his life by placing a shotgun to his chest and ending his life. A short while later, my parents brought me, I still don't know why, to Grandma's house, where I saw my aunts, uncles, and family, especially my grandmother, wailing and crying like I'd never seen before. I've thought about that day ever since. Suicide. The word's powerful, captivating, and uncomfortable. Even though a person dies by suicide every 10 minutes in the US. Yet, hardly anybody talks about it unless you bring up the subject. Then everybody seems to have a story. But here's some good news on suicide. You can make a difference. And it can be as simple as starting the conversation. Depression and loneliness are the leading causes of suicide. In the United States, over 9 million men, women, and children will be diagnosed with depression. Anybody who's ever been depressed knows what that's like. It's kind of like walking in fog with heavy lead boots, not knowing where you're going, where your aim is. From that 9 million, about 1 million attempt suicide. And since 2020, we've had nearly 50,000 people die by suicide every year. That's the most ever since World War II. What is suicide? It's severe isolation. It's a feeling of being a burden on your family or society. It's severe hopelessness in a vulnerable moment with access to a lethal means. Those are the ingredients. And it also comes with usually a lack of access to care, financial and employment distress. The thing is that 50% of those who take their lives by suicide will never, ever give you any signs. The growing suicide statistics in the United States. Suicide's now the leading cause of death in children 10 to 14 years old, as well as in adults 25 to 34. How did we get there? Globally, suicide is the 4th leading cause of death in young adults, 11th overall. And did you know 40 veterans die by suicide every day? We used to think the number was 20. Yet, the media never talks about it. Why? Isn't 50,000 people enough suicides or a large enough number to raise some level of concern? I mean, think about it. That's like a fully loaded 737 or Airbus hitting the ground like a lawn dart. All souls lost every day. And then, even worse, since 2020, there's been about 100,000 overdose deaths. How many of those could have been suicides? Here's my transformation. Why did I get into all this? I'm an anesthesiologist after all, not a psychiatrist. During medical school, I was always intrigued by suicide and mental health. Ster quinilinis inventeur, sorry for the French accent, is Latin, is found in the manure, or idiomatically, what you need most will be found where you least want to look. That's usually how life's biggest problems present to you. In my medical career, I've been fortunate to work with amazing authors like Gavin de Becker. He wrote The Gift of Fear. He's been on Oprah numerous times. It's sold millions of copies and positively affected millions of lives all around the world. He asked me one day, Jonathan, how do you feel about the drug ketamine? Took me by surprise. I was like, well, I'm a board certified anesthesiologist, and I said I know a lot about ketamine. It's safe. I give it in anesthetics. I've been using it for 25 years. It's used a lot in pediatric anesthesia. Has a great safety record. It's on the WHO list of essential medications. But then I also said, I know it was repurposed because it can also treat depression, anxiety, PTSD, and it can stop suicide. Gavin paused and he said, not congratulations, but I'm glad you answered that question that way, Jonathan, because I just want to tell you, I was prepared if you had answered the question the other way. Taken aback, it's important to ask why Gavin was ready to debate if I had asked the question the other way. Ketamine is the most important breakthrough in mental health in over 50 years. That's from Thomas Insill, MD, former director of the National Mental Institutes of Health. Many believe that ketamine is nothing more than a horse tranquilizer or a party drug, and that many healthcare providers are unaware that it can even help depression or suicide. Being an anesthesiologist, I can tell you it's safe. I've used it for decades. When properly used, it's one of the safest anesthetics we have, actually. That day, Gavin and I agreed the world needs to know that a little known drug called ketamine can stop suicide. That's why I wrote this book called The Revolutionary Ketamine. It's a safe drug that treats depression and can stop suicide. What makes it revolutionary? Well, we don't have any other drugs that can stop suicidal ideations like that. And the discovery of ketamine as a rapid-acting antidepressant marked a new era in the development of neuropsychiatric therapeutics. Instead of waiting months for an effect, ketamine produces antidepressant effects within hours, something we'd never seen before. Research has shown that even a single infusion of ketamine can stop suicidal ideations. Again, we'd never seen this before. Other peer-reviewed studies have shown that ketamine can abate suicides in up to 70% of individuals in outpatient psychiatry clinics. And when paired with psychotherapy, the effect of ketamine is staggeringly effective. These kind of results were unheard of until now. One of my favorite studies is from Dr. Lori Calabrese. In 2019, she conducted a study involving 231 adults and adolescents with suicidal ideations, depression, and other psychiatric illnesses and comorbidities. This is a real-world outpatient setting. In her study, 79% of individuals stopped their suicidal ideations. There were 0 suicides in her study. Dr. Calabrese calls ketamine fertilizer for the brain. Some others say when you give patient ketamine, it's like doing 6 months of psychotherapy. Dr. Calabrese's latest research is about combining a ketogenic diet with ketamine and therapy. It's a pretty novel idea. How does ketamine work? Well, scientifically, it works by blocking what are called the NMDA receptors and increasing that neurotransmitter called glutamate. This in turn promotes the growth of new neural connections, and particularly in the areas of brain most responsible for regulation of cognition and function. So that's the scientific. But there's another side to that. Mental health is it's more than just the absence of a mental disorder or disability. Part of the reason ketamine works is because it treats more than just the biological problem. Ketamine treats the root cause of depression. The experience involves the mind, body, and spirit that dissolves ego, dissolves time, and it taps into the language of the human psyche. Carl Jung once said that the psychotherapeutic endeavor is the pathway of truth. Ketamine with therapy allows patients to process complex emotions and past trauma and work towards inner healing and giving hope that things can change. So you might ask, why isn't ketamine a standard pharmaceutical for mental illness? Well, pharmaceutical companies would love to just pack a version of ketamine into a pill. But I'm here to tell you, it's not likely. They've tried. You cannot pack a biological, psychological, spiritual experience into a pill. Other reasons are it's out of patent, and its use is off-label for mental illness, as are 80% of all drugs, by the way. Spravato, S-ketamine, is the only FDA-approved version of ketamine for psychiatric disorders. And it also has safety concerns. You know, you've heard of Matthew Perry. He died apparently from a ketamine overdose. There's much more to that. I've written about that in my Substack. And there's also the stigma that ketamine is just a party drug. Well, let me get something very clear, that ketamine is not. Street ketamine and pharmaceutical grade ketamine are two different animals. Street ketamine is often laced with other chemicals made on the street, often impure, and people take it in enormous doses. When given into a clinic, you're giving 1/10 of the dose of what these people in the street take. Plus it's in a monitored professional setting. Research gaps. Some say there's not enough research on it. There is. What I can say is not enough mental health providers advocate its use. And of course, pharma companies don't like to invest in something that they're not going to make a huge profit on. You ask, is ketamine safe? Yes. I mean, there's been 70,000 studies in the literature around ketamine. And most of them all showing it's a safe and effective medication when given professionally in supervised settings. It does increase blood pressure and heart rate. It can induce nausea and vomiting, has a potential for abuse. It does cause dissociation and out-of-body experiences when given in excess doses. There are bladder issues with long-term misuse of street ketamine. It's known as ketamine bladder. Again, this does not apply to what goes on in ketamine clinics. There is potential for addiction, particularly with the misuse of outside of medical settings, like Matthew Perry. So what's ketamine used for? I mean, you've heard all of this about it. Well, it is. It's primarily an anesthetic that we use as anesthesiologists in the hospital for sedating patients. I can tell you it's a miracle drug in burn rehab, where you have to do dressing changes every day on burn victims. They get one of the first line drugs to do that is ketamine, just to give you an idea. In the mental health area, it's a treatment for depression, especially treatment-resistant depression, which is a different animal than just regular grade depression. It's also used in pain management, including chronic pain management, where you got like chronic pain regional syndrome, and it can actually decrease the amount of opioids that one uses. That's a huge benefit, especially when we think about, the overdose and opioid crisis we're currently facing. Its treatment, it treats anxiety and PTSD, especially when combined with psychotherapy. It's given standard intravenously through a vein, through an IV. It can also be given intramuscularly. It's given intranasally, orally through a troche, and also given subcutaneously in some instances. Here's a heavy subject. Children and suicide. It's important to realize children experience suicide much differently than adults. 50 years ago, it was extremely rare to ever hear about a child taking their own life. If you look at the data back then, the curve was flat. Today, according to the NIMH, 4 million adolescents aged 12 to 17 been diagnosed with depression. Lockdowns and the pandemic had much to do with this. Even the former CDC director, Dr. Robert Redfield, accurately stated that over 7 million adolescents receive their mental health care in schools, and that locking them out or keeping them at home would exacerbate this problem. And it came true. In my former city, in Las Vegas, there were 18 school-age children who all took their life in the span of 1 year in 2020. And these weren't kids who were high on the psychotic or psychiatric problem spectrum. These were regular school kids during lockdown with depression and other like illnesses. That's important to understand. Social media, it's this generation's cigarettes. It hooks them and it gets them hooked young. It's like Vegas slot machines. These social media companies, they know who you are, how you play. They do the same thing with likes, shares, and comments. This is called variable reinforcement. We know that our adolescents spend 7 to 8 hours a day on a smartphone in many cases. Maybe we need to consider an old style watch with just a hands and a ticker. Go back to that. As we all know, it begins with the parents. Awareness is corrective in itself. I would encourage you to read Jonathan Haidt. He has much more on this subject. Veterans and suicide. Combat's no longer the major killer of soldiers. What is? Suicide. We don't hesitate to send our soldiers to war. And the thing is, when those soldiers go to war, they don't really know themselves. But when they get to war, they find themselves doing things that they never thought they were capable of. And when they come back, they find out that there's really more to them than they thought possible. That's when PTSD ensues and ensnares them, and then they fall apart. Some say, it's just PTSD, get rid of it. That's not the right way to think about it. PTSD won't get rid of them. That's why we have 40 soldiers dying a day, or veterans, from suicide. It's mostly younger veterans. And it's also because veterans own more guns and they're very well trained in how to use them. Of course, obviously it's mostly males. The thing is that governments don't hesitate sending our soldiers to war, but they absolutely hate paying for the treatment they need when they come back. That's a travesty. Every administration since Nixon has put up some kind of campaign to decrease veteran suicide. Every one of them. And look where we are. The Vietnam War is interesting. It's useful to know that the FDA fast-tracked ketamine's approval in 1970. Why? Because it became a battle buddy drug. One way you can understand ketamine and its safety is that when given in these scenarios, another soldier can get their fellow wounded soldier back by giving them ketamine and kind of dissociating them away from the trauma they just experienced and get them back to safety. It also helps them with their pain, doesn't stop their breathing, doesn't affect their blood pressure. You don't need oxygen. And this is why it's still the world's most utilized anesthetic even today. First responders and suicide. It's also a very difficult topic. More firefighters and police officers lose their life to suicide than in the line of duty. Think about that. Here at IHMC, they held a Blue Sky event in 2024 to address this astronomical problem in Florida. In one Florida precinct, they lost 4 firefighters to suicide in 1 year. Think about that. These are young, valuable people to society, and we're just losing them. Of course, PTSD is one of the major causes, and as I said, PTSD is a rut that you cannot get out no matter how hard you try. And the thing is other drugs like MDMA have shown promise in stage 3 trials at Johns Hopkins, but recently the FDA denied the ability to be able to prescribe MDMA for PTSD along with therapy. That was I wasn't sure who came to that conclusion, but obviously there probably wasn't enough profit. Anyway, ketamine along with therapy is a very useful tool to treat PTSD. Okay. So now here's the good news. I've given you a lot of low, hard to swallow facts and things like that, I realize there is some good news. Here's some stories of individuals whose lives were transformed by ketamine. In 2012, the New York Times reported for Dennis Hartman. He's a businessman from Seattle, and he says, "I look at the cost of not using ketamine. For me, it was certain death." Dennis suffered from a lifetime of treatment-resistant depression, and he even had a suicide date picked out before he entered a National Institutes of Health ketamine study. Once he got the ketamine, his depression lifted, and he uses ketamine as needed to treat his depression, and he even started a foundation called the Ketamine Advocacy Network. One of my patients in my former city was involved in the Mandalay Bay Massacre. You may remember October 1st, 2017. Las Vegas, Nevada. The man Jason Aldean was on stage. 58 people tragically murdered, 850 injuries. My patient, Dan, we'll call him, he was a first responder on the scene, and he still suffers PTSD to this day. He cannot unsee what he saw. He's tried everything through psychotherapy, standard antidepressants, and other modes of psychiatric care. And for him, ketamine is what helps. He receives ketamine sometimes monthly and as needed. Iraq war veteran Mike Donnelly, he's one of our veterans, came back suicidal with PTSD. He presented to his VA. He was at the emergency room, and he said that the physician assistant just handed him a card and said, "Dial this number." It's quite a thing to say to somebody who, especially a veteran, who says they're going to take their own life. Hand them a card. It was beyond me. This guy's at the end of his rope. He doesn't have a job. He's losing his family. He's planning his own suicide. He reads about ketamine, but he couldn't afford the treatments. Finally, after some months, he sells his prized guns, raises enough money to get the ketamine treatments, of which his insurance company would not cover. They'll cover Spravato, but they will not cover what we say standard intravenous clinic ketamine treatments. He received ketamine therapy, improved, his depression lifted, got therapy, got his life back. He got his family back, and he became a father again. I treated a 17-year-old young man, came in with severe social anxiety and depression and suicidal ideations. So I treated him. After the first treatment, the suicidal ideations abated, decreased. After the second treatment, you could see that things were changing. His depression was less. After the third treatment, he started seeing that he had a future and that he could move on and start improving his life, and that through an act of will and control, the obsessional thinking that led him to this dark place went away. He even eventually stopped his antidepressant medications. One of my favorite is Olive's story. She wasn't my patient, but I love the story. She presented to a Florida clinic. She's a 26-year-old with a history of PTSD, anxiety, bipolar disorder, several suicide attempts throughout her childhood and adult life. She booked a ticket to the Netherlands to undergo a compassionate euthanasia because she found no other way to deal with her pain. And an aside, suicidal patients desperately want to live. They just don't see any other way around their pain. On the day she was to leave, at the behest of a friend, she checked into a clinic that gave ketamine. She received 3 ketamine treatments during that week, and her suicidal ideations went away, and she never took that flight. I had another patient with prostate cancer. He presented with suicidal ideations, and he was put on the testosterone blocking medication Lupron. He presented with 9 out of 10, we'll say, on the suicide scale, and went, give me the gun and I'll use it. The only thing he did not want to check himself into a hospital, even though I tried, but he stated clearly, if I had a way to end my life now, I would. So he underwent a ketamine treatment. This abated his suicidal ideations, after which he saw a psychologist, a Reiki healer, and even tried THC. He stopped the Lupron, underwent several sessions of localized radiation for his prostate cancer, and then he even later repeated the ketamine treatment and had a very enlightening experience and is doing well today. Finally, I had an elderly patient, and I thought this was a neat story. He underwent a ketamine treatment, and he told me that for the first time ever, he saw himself through his parents' eyes, and that he was not a bad person and he should not be ashamed. He spoke of words of acceptance, perhaps a sense of being enough, and that everything is going to be okay. So some other things, ketamine's unusual history. It was first synthesized in 1962 by a pharmacist named Dr. Calvin Stevens. Again, it was fast-tracked in 1970 for the Vietnam War, and it quickly became the most utilized anesthetic worldwide. And again, ketamine can be administered without oxygen or hemodynamic monitoring, and that's what makes it the most utilized anesthetic, because in most places in the world, they don't have what we have in Western society: functioning electricity, dependable oxygen, or even dependable medications. A lot of medicine is done at people's homes in what we would call rural clinics. And that's why it's on the WHO's list of essential medications. And this, by definition, says it meets the important needs of a basic healthcare system. Many people don't know that ketamine has plant-based origins. The Peruvian torch cactus. It's known to contain precursors of ketamine called hydroxynorketamine. The bark of acacia trees. Maybe some of you in this audience have some acacia trees at home. Contains alkaloids, one of which is ketamine. The point is ketamine's pharmaceutical inspirations were from nature or from plants, plant-based, if you will. And that's what shaped its initial developments. I get this question a lot. Is ketamine a psychedelic? I say ketamine is a psychedelic, and that's despite what the research says. The research says it's a psychedelic-like substance. There are studies that shows it touches the serotonin 5-HT2A receptors, while the primary mechanism involves in NMDA receptors the modulation of serotonergic pathways, including the 5-HT2A receptors, could be part of a broader network disturbance that leads to the neuroplastic changes for the benefits of ketamine. I mean, it's like any other psychedelic. It transcends physical reality. It produces a mystical experience, ego dissolution, loss of time, oceanic feeling, visual hallucinations, integration. Those are all standard signs of any psychedelic. And again, it's a biological, psychological, spiritual experience that cannot be put into a pill. My first book on the subject was called Suicide, COVID-19, and Ketamine. This was a book highlighting the consequences of lockdowns and mental health issues that came along with it, especially in kids. And a neat story I have is the new NIH director, hopefully, Dr. Jay Bhattacharya. I was talking to him one day at a meeting, and we were talking about children and suicide, and I introduced myself, and he paused and stepped back, and he goes, "Oh, you're Jonathan Edwards?" I was like, "Well, I just thought to myself, that's interesting. I know who you are, but I had no idea he knew who I was." And turns out he had already read the book Suicide, COVID-19, and Ketamine, and said I was the only one writing about the subject of children, suicide, and lockdowns. After this book, Skyhorse Publishing and Simon & Schuster asked me to write a second edition, and this became The Revolutionary Ketamine. This book focuses more on veterans, first responders, children, and athletes. And the audiobook just came out, and I read it. Warning, I'm a better doctor than a voice actor. The Revolutionary Ketamine. One of my highlights was giving my book to psychologist Jordan Peterson personally. He himself had a hard time with ketamine when he was sick, overcoming benzodiazepines. We discussed ketamine at length, and at the end of the discussion, he agrees that it has enormous potential to treat mental illness when paired with psychotherapy. I've had many other experiences with athletes in the UFC, especially talking about CTE, which is chronic traumatic encephalopathy and suicide, of which I've had athletes take their own lives, and I've been in the middle of it all. Here's Darren Waller. He's a big advocate of ketamine and mental health, and he has a great story. He's a former tight end for the NFL. Some of you may have heard of him. Here's in the middle, Misha Tate. I've worked with her since the mid-2015 up to her championship, where she beat Holly Holmes and was for a period of time, the women's world champion, UFC champion. And then on the right here, you can see Francis Ngannou. He's a Cameroon MMA fighter and boxer, and we speak French together. But he also liked the idea, and we discussed the things in the book and about athletes. My book even took me to the Supreme Court. Here I am with some of you may recognize detransitioner named Chloe Cole. So I got to write, the lawyer came up to me and I got to write the Section 1B for the Supreme Court case, Scrimeti versus the U.S. for the blocking of transgender procedures in kids. And I wrote the section that medicine is discriminatory for a good reason. Anyway, I talked with Chloe about the possibility of using ketamine at an early stage in her gender dysphoria. And after hearing about it and the possibilities, she agreed and was hopeful that people should consider things like ketamine or other psychedelics in their journey of gender dysphoria before they make any big decisions, and have surgery removing healthy body parts. I did a speak event called Speak Event Health in New York. It's a subsidiary or a breakoff, if you will, of TED Talks, some of the same organizers. And there I told my story, basically what I told you tonight, except I didn't get to use slides at all. had to come off my tongue. That was a hard night, but it was fun and very satisfying. I've been on several podcasts talking about ketamine and mental illness and the possibilities, what it is, what it isn't, and I always try to keep ketamine in a real light. I try to keep it real. It's not for everybody. It's not going to treat 100% of people. It's right for some people, very wrong for others, and the choice is individual. But I would like to say that if you're that mom or dad, and you have that child who's you're watching them and they want to take their life, and you've tried everything, and if you knew about ketamine, would you try it? Would you use it? Would you give it to your loved one? That's the message I want to deliver. I'll finish. I think there's a sunrise to all of this, and we're in a new era where I think kids are going to be able to flourish more. And this picture, I was in the Dakar rally for 5 years in Africa. And I took this picture in Mali, and it's just I hope the sun is rising. And I think there's a lot to that. Lastly, I accept truth is adventure, and I wish you all the adventure of your life. Here I am with my family in our house in France. My beautiful wife, Mylene, and daughter who are in the audience there. And special thanks to Dr. Ken Ford, who without his help and support, none of this would be possible. And just want to express my gratitude. Thank you.